The ovarian cancer diagnosis came 10 weeks before the hospital board meeting. I was 31 working as an architect when the abdominal pain and bloating became unbearable. The CT scan showed a large mass on my right ovary, stage 3 ovarian cancer requiring immediate surgery and chemotherapy. Dr. Rebecca Torres was the chief of gynecologic oncology at Riverside Hospital. She showed me the imaging with careful gravity. This is advanced. We need to operate within 2 weeks. Full hysterectomy, omentectomy, lymph node removal. Then aggressive chemotherapy. Without treatment you have maybe 6 months. I called my parents that evening. My sister Lauren answered the phone. Hannah, I'm studying for boards. What's wrong? Lauren was a third-year resident in internal medicine at Riverside, the same hospital where I'd been diagnosed. She'd spent 3 years convinced she knew more than every attending physician. Lauren, I need to talk to Mom and Dad. I have ovarian cancer. Silence. Then laughter. Ovarian cancer? Hannah, you're 31. That's extremely rare. You probably just have a cyst or endometriosis. Lauren, the imaging shows a malignant mass. Imaging is interpretive. These radiologists overcall findings constantly. Trust me, I review scans every day. Her voice turned dismissive. You're being dramatic again. It's probably nothing. Mom's voice joined the call. What's going on? Hannah thinks she has ovarian cancer, Lauren said with amusement. Can you believe it? Ovarian cancer? Honey, that's very unlikely at your age. Are you sure you're not just stressed? Mom's tone was patronizing. You've always had health anxiety. 3 different doctors confirmed. Then get a 4th opinion. Doctors are wrong all the time. Lauren sounded confident. Look, I'm presenting my research at the hospital board meeting in 10 weeks. I don't have time for your medical drama. Just take some ibuprofen and relax. The surgery was scheduled for 12 days out. I told my family at Sunday dinner. Lauren came straight from the hospital in her white coat, setting it carefully over her chair where everyone could see it. You're actually scheduling surgery? Hannah, this is insane. You're letting some surgeon talk you into unnecessary abdominal surgery. Lauren, I have pathology confirming adenocarcinoma. Pathology can be wrong. False positives happen. She exchanged knowing looks with our parents. Who's doing the surgery? Rebecca Torres. She's known for being overly aggressive. Probably wants to pad her surgical numbers. She's the chief of gynecologic oncology. At Riverside, sure. But I work there, Hannah. I know which surgeons are trustworthy. Torres operates on everything. She's probably exaggerating your condition. Dad nodded. Your sister knows what she's talking about. She's almost a doctor. I have stage 3 cancer. According to people we don't know. I'll have one of the attendings look at your scans. I'm sure they'll tell you it's nothing serious. Lauren's voice turned cold. Honestly, Hannah, this feels like attention-seeking. You've always been jealous that I'm the successful one. Now I have a major board presentation and suddenly you have cancer. The surgery happened on schedule. My friend Maya took 3 weeks off to stay with me. My firm told me to take all the time I needed. My family sent a text. Hope your procedure goes well. Remember, Lauren's board presentation is in 8 weeks. Dr. Torres spent 9 hours removing my ovaries, uterus, fallopian tubes, omentum and lymph nodes where cancer had spread extensively. The pathology showed high-grade serous carcinoma with peritoneal involvement, worse than initial staging suggested. I woke up in ICU unable to sit up, facing months of brutal chemotherapy. Maya stayed every day helping me through the surgical drains, managing pain medication, holding my hand through the reality that I'd never have children. My family visited once, 4 days post-op. Lauren walked in wearing her white coat, stethoscope around her neck, clipboard under her arm, making sure everyone knew she was the medical professional. So what did they actually find? She asked, not looking at my bandaged abdomen or the drainage tubes. Stage 3C ovarian cancer. High-grade serous carcinoma. It had spread to my peritoneum. Lauren rolled her eyes. Staging is subjective. What one oncologist calls 3C, another might call 2B. This doesn't prove you needed this extensive surgery. Lauren, they removed cancer from multiple organs. Because Torres is aggressive. I bet a less knife-happy surgeon could have done something minimally invasive. He checked her watch. Anyway, you'll be recovered from my board presentation, right? The whole family needs to be there. It's a big deal for my career. I start chemotherapy in 3 weeks. Chemotherapy? For what Lauren just said might be stage 2 cancer at most. Mom looked concerned. Honey, that seems excessive. 3 pathologists confirmed stage 3C. Pathologists protect each other. They're not going to contradict each other's over readings. Lauren's voice was firm. Hannah, I'm telling you as someone who works at this hospital, you're being overtreated. Skip the chemo. You'll be fine. They left before my surgical oncology team came for rounds. What Lauren didn't know, what she'd been too arrogant to pay attention to, was that Dr. Rebecca Torres wasn't just chief of gynecologic oncology. She was on the hospital's executive committee and reviewed all resident performance evaluations. She'd been observing residents for months, including Lauren's unit. The recovery was brutal. 6 weeks post-op, still weak from surgery, I started chemotherapy. Carboplatin and paclitaxel that made me vomit for days, left my hands and feet numb, stole what remained of my hair. Maya coordinated care with friends. My family called twice, both about the board presentation. Hannah, Lauren's presenting her research on patient satisfaction scores. The whole board will be there, including the CEO. We need you there looking healthy. Mom, I'm on chemotherapy. That was your choice. Lauren didn't tell you to do chemo. The least you can do is support her big moment. 8 weeks into treatment, I was hospitalized for neutropenic fever, a life-threatening complication. Dr. Torres admitted me directly to the oncology floor, the same floor where Lauren was rotating. Lauren appeared during rounds, annoyed. Hannah, what are you doing here? Lauren's presentation is in 2 weeks. You don't have time for hospital drama. Your sister has neutropenic fever from chemotherapy, Dr. Torres said coolly. This is a potentially fatal complication. Neutropenic fever happens to lots of chemo patients. It's not that serious. Lauren waved her hand dismissively. Hannah's always been overdramatic about symptoms. She probably just has a regular fever and the oncology team is overreacting. Dr. Torres closed my chart slowly. Dr. Harrison, your sister has a documented absolute neutrophil count of 200. She's severely immunocompromised and at risk for sepsis. If you say so. I think she's just playing sick to get attention before my presentation. Lauren crossed her arms. Honestly, this whole cancer thing has been suspicious from the start. Stage 3 ovarian cancer at 31? The diagnosis was probably wrong. The diagnosis was confirmed by pathology, staging surgery, and imaging. Confirmed by people who didn't want to admit they were wrong. Lauren's voice rose. My sister is faking severity to steal attention from my career milestone. I've seen it my whole life. Whenever I achieve something, Hannah suddenly has a medical crisis. The nurses in the room exchanged shocked glances. Dr. Torres's expression went ice cold. Dr. Harrison, you're suggesting your sister fabricated stage 3 ovarian cancer? I'm suggesting she's exaggerating normal symptoms and letting doctors overtreat her for attention. Lauren gestured at me. Look at her, she's fine. Sitting up, talking normally. This hospitalization is unnecessary. She has a fever of 103 and a white blood cell count that puts her at risk for death. Or she has a regular fever and the labs are misread. It happens constantly. Lauren checked her pager. I have rounds. Tell Hannah to be at my presentation in 2 weeks, looking presentable. She left. Dr. Torres sat beside my bed, her expression furious. Hannah, I need your permission to do something. What? The hospital board meeting where your sister is presenting. I'm on that board. I review resident competency. And I'd like to present a case study on dangerous medical arrogance in residents. I looked at her. Using my case? Yes. Your sister just told me that stage 3C ovarian cancer is probably fake, that chemotherapy complications are attention-seeking, and that neutropenic fever isn't serious. Dr. Torres's voice was hard. She's a danger to patients. The board needs to know. The board meeting happened 2 weeks later. I was still weak from the hospitalization, but stable enough to attend. Maya drove me to Riverside's main conference room. The boardroom filled with hospital executives, department heads, medical staff. Lauren sat near the front with other residents, confident and prepared, her research presentation queued on her laptop. Dr. Torres opened the meeting. Before we hear from our residents, I need to present urgent findings regarding resident competency and patient safety. Lauren's smile faltered slightly. 3 months ago, a 31-year-old patient was diagnosed with stage 3C high-grade serous ovarian carcinoma at this hospital. She underwent extensive debulking surgery and is currently on aggressive chemotherapy. Dr. Torres pulled up my imaging on the screen. My surgical photos. My pathology reports. This patient's sister is a third-year internal medicine resident at Riverside. When informed of the cancer diagnosis, this resident told her sister it was probably nothing and attention-seeking. She told her to cancel surgery. She called the chief of gynecologic oncology overly aggressive. She suggested chemotherapy was unnecessary. Murmurs rippled through the room. Lauren's face went white. 2 weeks ago, when this patient was hospitalized for neutropenic fever, a life-threatening complication, this resident told nursing staff and attending physicians that her sister was faking and playing sick. She claimed stage 3C ovarian cancer was probably misdiagnosed, and that documented neutropenic fever was probably just a regular fever with misread labs. The room erupted in whispers. Department heads turned to look at Lauren. That resident is Dr. Lauren Harrison. The patient is her sister, Hannah Harrison, who is here today, 8 weeks into chemotherapy for confirmed stage 3C ovarian cancer. Every head turned. Thousands of eyes on me, then swiveling to Lauren. Dr. Harrison told her dying sister to skip cancer treatment. She accused oncology staff of overtreating. She dismissed neutropenic fever as attention-seeking. Dr. Torres's voice cut through the noise. A resident who cannot recognize stage 3 cancer, who dismisses chemotherapy complications, who accuses patients of faking life-threatening conditions. That resident is not safe to practice medicine. The hospital CEO stood. Dr. Torres, you're recommending? Immediate termination from the residency program. Review of her clinical decision-making on all patient cases. And reporting to the medical board for competency evaluation. Lauren tried to speak. Dr. Torres, this is a family matter. This is a patient safety matter. You're a resident who told a cancer patient her diagnosis was fake. You called verified pathology results probably wrong. You dismissed neutropenic fever as normal. Dr. Torres pulled up documentation. I have notes from every interaction where you questioned validated diagnoses, undermined treatment plans, and told your sister and medical staff that confirmed cancer was attention-seeking. The program director stood. Dr. Harrison, gather your things. You're dismissed from the program effective immediately. You can't. I'm presenting my research. Your research is irrelevant. You've demonstrated dangerous clinical judgment and complete lack of patient empathy. The CEO's voice was firm. Security will escort you from the building. Lauren's presentation never happened. She was escorted out by security while the entire board watched. Her research was pulled from the agenda. Her white coat was surrendered at the door. My parents tried calling that evening. I didn't answer. They sent an email. Hannah, you destroyed Lauren's career. 3 years of residency erased because you went to the board. How could you? I responded once. I didn't go to the board. Lauren came to my hospital room while I was dying from chemo complications and told my doctor I was faking cancer. That's not a family issue. That's a resident safety issue. They didn't write back. The chemotherapy continued. 12 brutal weeks total. Maya and my friends surrounded me with support. My firm held my position and sent care packages. My family sent nothing. 6 months post-surgery, my scans showed no evidence of disease. Dr. Torres was cautiously optimistic about remission. 9 months post-surgery, still cancer-free. The medical board completed their review of Lauren. Her residency was terminated with a flag on her permanent record. She'd have to reapply to any program and disclose the termination. Most programs wouldn't touch her with a competency flag. My family tried apologizing through my aunt. Lauren made a mistake. She's lost everything, her residency, her career path, 3 years of work. Can you help her? But telling your cancer patient sister that she's faking isn't a mistake when you're a medical resident. And losing everything only after public exposure isn't real remorse. It's regret about consequences. 1 year post-surgery, I celebrated remission with Maya, my friends, and Dr. Torres. We toasted to survival, to doctors who believe their patients, to the importance of clinical humility over arrogance. My phone buzzed with a text from Lauren. Heard about your 1-year remission. Glad you're doing well. I'm reapplying to residency programs. Could you write me a letter of support? I deleted it. Because being glad I survived after telling me I was faking cancer isn't real concern. And asking for support after you tried to convince me to skip treatment isn't real relationship. It's manipulation. 18 months cancer-free and I've never been stronger. Not because the cancer left, but because I learned that sometimes the most dangerous medical advice comes from family members in white coats who value their careers over your life. Riverside uses my case in resident training now. Not to shame Lauren but to teach hundreds of future doctors about the dangers of diagnostic arrogance and the importance of believing patients even when you think you know better. Lauren's name was removed from the Resident Honor Board. Her research was never published. And the medical community learned that 3 years of training mean nothing if you can't recognize when your own sister is dying. The surgical scars remind me every day. I trusted my gynecologic oncologist over my internal medicine resident sister. And that trust gave me a future Lauren said I was faking to get. Some families will never see your suffering until it destroys their professional dreams. And by then, you've already learned that survival means trusting the doctors who actually looked at your pathology over the family members who dismissed it without looking.